Hi, so my name's Chris. I'm a registered nurse with a background in emergency care and clinical research. I'm going to speak to you about my research, which aims to develop an intervention for people with multimorbidity. The multimorbidity is simply the term that we use to describe when someone has 2 or more chronic illnesses. It's very common. More than a quarter of all people have got multimorbidity. It's very complex. If you just take 10 chronic illnesses, there's more than 1,000 ways that someone can experience those chronic illnesses in different combinations. Despite this, our healthcare systems are still predominantly set up for the management of single diseases. Take the image on the screen in front of you. This is someone with several chronic diseases which are affecting multiple body systems. They see a range of different specialists and take different drug regimes to manage them. Now, in an ideal world, all these treatment regimes would fit together nicely like pieces in a jigsaw puzzle. But the reality is that treatment plans often overlap. People can end up taking too many drugs, for example, that possibly aren't needed. They might have to go to too many appointments, and treatment can actually become a burden for people with multimorbidity. The other side of this problem is that gaps can appear in care, and people can actually have discontinued and broken care as a result of these gaps in treatment plans. For example, not having access to certain drugs or treatments when people are transferred from hospital to home to care home. Early findings from my systematic review reveal that nurses are quite involved in dealing with this fragmented care rather than dealing with disease-specific outcomes when it comes to multimorbidity. An example of this would be case management, where nurses adopt a leadership role and help to coordinate between multiple different specialists to ensure that the individual's needs are at the centre of all decisions about their care. In a population who are frequently admitted and discharged from hospital, nurses are also involved in transitional care. That is supporting people to make sure that there's continuity as they're transferred from one specialty in one area to another. Not all chronic disease exacerbations require admission to hospital, however, and also what you'll find is nurses involved in supporting people to self-manage aspects of their chronic disease in a way that prevents them from having to come into hospital at all. We've found out a little bit about what it is nurses do when they're caring for people with multimorbidity. The next steps in my research are going to involve actually trying to characterise if there are certain clusters of diseases, or indeed if numbers of diseases that people have contribute to poorer outcomes when someone is admitted to hospital as an emergency. The end result of this will be that we will develop and trial an intervention designed to improve the care that people with multimorbidity receive. The exact shape of that intervention is yet to be decided as a result of the research we're going to conduct. But the one thing that will be definite is that the aim of this will be to ensure that the care we provide for people works hard for them and that people don't have to work hard for their healthcare. Thank you.